their mindsets, stepping up in times of challenge and answering the call to greatness, not accepting venting as a norm of communication. We have to get, each of us, really, really good at doing this. It's kind of a you go first attitude. One thing that Sai says is anything that you're lacking with your teams, your leaders, oftentimes even our patients, our families, our children, that which you are lacking, give more of first. Oftentimes we will see, we'll co-create a new circumstance and we'll be able to step into that greatness much more quickly. Secondly, accountability is a mindset. It's a choice. Who has used the term hold someone accountable in the last several months? Sai's philosophy, which is research-based, 30 years of research in psychology from her and some of the leading psychologists worldwide, have found that we really can't do that. It's not effective to hold someone accountable because accountability is a personal choice. As leaders, though, it's our job to cultivate environments where accountability is a really simple choice, where there is no third option when it comes to accountability. And accountability is simply the mindset that we have a part in our circumstances, regardless of what those circumstances are. When she says there's no third option, we have very high performers that we know are all in. When they're met with a challenge, they say, how can I help? What can I do? How can we get there? And we have also, as many of you probably do, lower performers that when they hear about a change, the first thing they say is, we tried that 10 years ago. It's never going to work. We don't have the money. We don't have the tools. We don't have the people. All the why we can't. We need to really work to spend our time with those top performers, to have very difficult conversations with the poor performers that are not all in, to really pay special attention to those kind of choosing a third option, because in the philosophy, in ditching the drama, a third option shouldn't exist. So do any of you have people who work for you now or who have ever worked for you in the past that are like excellent clinicians? I hope to see some head shaking. Yep. Are any of those excellent clinicians also people that maybe once or twice have driven other caregivers to go home and cry themselves to sleep? Yeah, we call them talented terrors. That's the third option. Which we have to have very difficult conversations to rid our organizations of if we're leading in the reality-based philosophy. How do we make a very clear choice? Are you all in or are you all out? I'm here as your leader to help you either way. But that accountability, that choice is yours to make and can be the death of the ego in so much drama and really wonderful results when grown through self-reflection. Build dream teams. Any of you have teams, leaders underneath of you that have teams that have any open spots at all, any open roles? Most of us do. What an awesome opportunity to hire for that accountability to begin with. At Regional Health, we're moving toward a philosophy where accountability is as much of a non-negotiable competency, it's a choice, as clinical skill, as any clinical competencies or technical or administrative competencies. So start out on the right foot. Work to bypass your team's ego. Sai offers dozens of ego bypass tools. It's really a way to get out of that storytelling very quickly and into self-reflection. Lead your team with empathy. Compassion is so important. This message can be difficult when we first start to speak it and to use it in our organizations. I've learned that if you can really message it with peaceful edginess, right? Are you all in or are you all out? We find a lot of success, but we have to do that with empathy. I know you, I hear you, I see where you're at, and I'm calling you to greatness every day. And finally, one of my other very favorite quotes from Sai, your circumstances are not the reason that you cannot succeed. First of all, you're probably helping create whatever circumstance that is. Can you create something better? But our circumstances are simply the true reality in which we must all find success. That's the cornerstone of the philosophy. We will always have extenuating circumstances. Succeed anyway. It's exciting. We're happy to be kind of driving this philosophy in partnership with Sai Wakeman and her team. If y'all have any questions at all, some contact information for both Joey and I. We're happy to take questions offline, or if you have burning questions you want to ask right now. Reality-based leadership as well. Pretty simple website, realitybasedleadership.com. If any of you are on Facebook or Twitter, SCI releases free new content, it seems like nearly daily, that can help you learn the philosophy without potentially ever buying the book or bringing her on site or sending someone to become certified to facilitate her material. She's all about information sharing. So look her up on YouTube, Facebook, Twitter. Her new book hit the shelves on Tuesday, No Ego, How Leaders Can Cut the Cost of Workplace Drama, End Entitlement, and Drive Big Results. If you're anything like the leaders at Regional Health, that's an exciting place to be. Thank you so much. We're happy to be here today. We're happy to take any questions that you have. We're excited to be partnering with the philosophy. Again, we are open for questions. Reach out, find us on Twitter, on LinkedIn, give us a call. We'd love to help spread this message across the region as well, and get y'all out of some of that drama. Thanks so much. Awesome. What questions do you guys have? My mic has died.
On the reality-based,
Yes.
the 8 elements that you talked about.
Yes.
After
Right here.
is the assessment available or the questions that go with this piece?
It's something we found from best practice and then created for our regional health. We'd be happy to talk to you more about what that looks like. Yeah, if you want to reach out. Yeah, they're available. Yeah. Other questions, thoughts? Yes.
I guess yesterday I went to a course or a presentation in the ICU there at Regional. And
Great.
They're talking about how they made some like huge transformations there. How did this play into what their goals were? You know, they were trying to implement some kind of integrated team. Like, you know, there's other challenges going on at the same time that you're trying to change philosophy and stuff. Did you find any, like, was that hard to coordinate with, you know, competing agendas or something like that?
I don't think so. So the question is, so in our ICU, Dr. Ganganini and Angie Mills have really worked to drive some amazing business results. They've paid huge attention to patient outcomes, empowerment, engagement, communication. They've seen results that are not only leading the way at regional, but leading the way nationally as well. What I love about the philosophy is it supports our leadership competency model, which is the Lead Now model, which talks about how business results are as important as people results. Angie and Dr. Ganganini live that competency model and are so good at it. But the reality-based philosophy has really integrated well. She's having those tough discussions. That's why their empowerment changed. One of the reasons why their engagement changed, communication improved, outcomes improved, because she really let them know that there wasn't a third option. Like,
So was it the integrated team models that made the big improvements, or was it the reality-based leadership?
I think it was using some of this messaging to do the work that she did with the integrated teams. Yeah, a little bit of both. What I love about the philosophy is it can be used in tandem with a lot of other competing priorities, which we have many of as well. Yeah, great question. Other thoughts? All right, well, enjoy your luau, have fun, enjoy this weather. Thank you all so much.